Tampa, a psychologist has been stripped of his license and sued, accused of having sex with one of his patients. More, Mel?
Heather, Dr. Daniel Laram is accused of the unthinkable, having a sexual relationship with a woman he was treating for depression.
Psychologist accused of having a sexual relationship with a former patient. License has been suspended, but hey, I thought that was a felony. Shouldn't there be some charges here? And we know this, the woman who was being treated ended up having a mental breakdown.
Hey, everybody. Sorry I'm late. Tons of traffic. Thought we'd pick it up where we left off last week.
I guess I'm gonna be the one to ask. Do you have any donuts?
Damn, son, what the hell happened to you? Why, because you all decided to show up early and I'm comfortably dressed. You brought out my wine, sweet. I probably shouldn't drink this on an empty stomach.
I feel like this should be fun, but it's not.
What do you think about therapists offering sessions from their home instead of an office?
I think that you need to have a separate space because you need to separate your professional self from your personal self. So is it okay to have therapy sessions in your home? Yes, if it's a separate office, it's totally separate. My opinion is, you should not really have pictures of your family in that space because the whole purpose of the session is to focus on your client and your client's needs, so you don't want to have distracting things or things that they can bring into the session and try and reflect or deflect and put the focus onto the therapist themselves. You always want the main attention to be on the client. So if you can avoid it and if you can have an office that's outside of your home, I think that's better.
I think that it's fine as long as there's a professional environment and their house isn't a mess. And there's like a designated area, like an office or a living room, where they can sit down and talk seriously. And there's no distractions, no personal distractions or anything.
I think that it's not a good idea to have therapists work out of their house because it's going to be very hard for the therapist to separate personal and professional, along with the fact that the therapist might have certain things in their house, such as picture frames, that may trigger certain emotions for the patients.
What do you think about therapists offering their cell phone numbers to clients?
Again, it's like that concern for where is the boundary between personal and professional. I think that if the therapist has a cell phone that's dedicated just for their job, then yes, that's okay. In case of an emergency, if a client desperately needs to get a hold of the therapist, you want them to have a way to do so. However, I think that should be a separate cell phone than the personal one that a therapist might carry around to contact their own family or their own friends. So it's okay to give out a cell phone number as long as it's a dedicated cell phone number that's just for the purpose of clients getting a hold of them.
I think there's cell phone numbers on the majority of business cards nowadays, and cell phones are pretty much used as business lines anyway, so I feel that that's fine.
I think it's a good idea for therapists to give their cell phone numbers out to patients because patients could have emergency situations that they're in and they could have to send a text message or a phone call to schedule an emergency appointment.
Think of therapists cursing in a session to further their bond with their patient.
I think that certainly a hurdle when you're trying to build rapport and establish a relationship is to try and understand the client from where the client is at. And oftentimes a therapist will have to change the way that they talk to somewhat mirror that of their patient. So if the patient uses a lot of cursing and that's part of the way that they express themselves, then I would say yes, it is okay for the therapist to do that as well. Oftentimes then the client will feel, okay, this person understands me more, they can see where I'm coming from. Should they do that all the time? No, certainly not. Should they point out every now and then maybe what would be a better phrase to use or a better term to use? Absolutely, but not at first. Because if you do that at first, if right away you just say, you know what, no F-bombs, whatever, that can make it really hard to build that trust between patient and client, between therapist and client. So yes, it's okay, not all the time. And as long as the goal is eventually to talk about what are some other phrases that can be used instead, then it's all right.
As long as they're not being overly explicit and just dropping the F-bomb every other word, as long as they're doing it tastefully and still being semi-professional, I feel like it's fine. It's, freedom of speech, just as long as they're not being totally unprofessional about it.
I think that's unprofessional because if you're cursing in a session, that can bring the patient back to that situation and make the session 10 times worse.